Sound Orthotics is committed to helping you increase patient outcomes. When your patients are satisfied, we're satisfied. In order to produce clinically viable orthoses, we need the best possible cast to work from. When reviewing your casts, we look for a full arch contact, no air pockets, no thumb imprints, an accurate calcaneal bisection, and a smooth plantar surface without folds or wrinkles. As you can see, we use an optical laser scanner to digitally scan the bottom of your cast, not the inside. That's why the quality of your cast matters to us and ultimately to your patients. So let's look at a simple, reliable, and effective method for a perfect cast. Once you've completed your assessment, you'll need to gather your materials. You will need plaster rolls, a release medium, a small bucket of water, a pen, and a 6mm EVA wedge. For prone casting, the foot axis should be perpendicular to the table, neither inverted nor everted. Lock the mid-tarsal joint by loading the lateral column and find subtalar joint neutral. Capture that position and bisect the calcaneus prior to cast application. Measure minimum of 3 layers of plaster. Go from toe to toe over the calcaneus. This equals 2 layers. Then let gravity roll out your third strip. The total length of your plaster should go up 2 inches behind the heel and slightly down past the sulcus. Lubricate the foot with your choice of release medium. Vaseline works fine. Make a peace sign with your hand to grab the top edge of your plaster and hold on to it throughout the wetting and wringing out application or process. This technique makes it easy to keep the plaster stretched out in order to apply it to the foot. Try to get the plaster over the heel without moving it around too much, or it will smudge your bisection line. Now, smooth out the lateral border first, then carefully stretch out and remove all the air pockets from the arch region. Gently turn over the top edge around the heel. This will create a strong rib to assist in cast removal. It is not required, but you can also stiffen the front edge as well. So now's the time to clean your hands. Save your floors from all those nasty dried plaster bits. Here's a pearl for you. Use a 6mm EVA heel lift to load up the lateral column. This will eliminate your thumb indentation. This wedge will also help maintain a lateral arch shape, especially on hypermobile or flexible feet. It's extremely important to keep the wedge in the same plane as the met heads. Try not to pinch it inward or outwards. Now, gently remove the cast by releasing the skin around the outside edges. Gently dorsiflex all the toes, that removes the arch, and pull straight back on the ribs of the cast. Inspect the inside of your cast and make sure there are no air pockets or wrinkles. It is crucial to take this opportunity to check the cast against your patient's foot. It should have the same shape, the same forefoot and rear foot alignment. If you've done your job right, the plantar surface of your cast should be an exact duplicate of the plantar surface of your foot. No wrinkles, no smudges, no imperfections.